for Wellness Wednesday, and this week we are shining the spotlight on Cleft and Craniofacial Awareness and Prevention Month. Each year there are 6,000 to 8,000 children born in the U.S. with a cleft lip and or palate. Courtney Vinson, speech language pathologist and clinical education coordinator for UT Tyler's speech pathology program, is joining us now. Courtney, thank you.
Hi, thank you for having me.
Let's begin with the causes of cleft lip and cleft palate.
Yeah, sure. So cleft lip and cleft palate can occur together separately, and that happens when a baby's facial structures don't fully fuse during early pregnancy. So typically between the 4th and the 9th weeks in gestation. So it's among one of the most common birth defects. It affects about 1 in every 1,000 births in the U.S. They generally don't know what causes this issue, but there are several factors that can contribute. So inherited genes from one or both parents can cause this issue. Can also be associated with genetic syndromes such as Treacher-Collins or Pierre-Robin sequence. Environmental factors can also be a contributing factor. So this can include maternal smoking or alcohol use. Those things can raise your risk. A folic acid deficiency in early pregnancy, maybe exposure to certain medications during pregnancy, and premorbid maternal diabetes is also a known risk factor.
So if you find out that your baby does have a cleft palate or a cleft lip, what are some treatment options for you?
So the initial treatment is typically a surgical repair. Doctors like to repair the lip first if there's a combination lip and palate cleft. The lip is typically repaired around 6 months of age. Then the palate is repaired around 12 months of age. Now, there are other surgeries that can happen later that can affect as teeth come in or orthodontics. Other surgeries might need to take place. We know that once a child has a cleft, they can have some speech sound disorders that they either are compensating before they have a repair, that they kind of hang around after. So a speech therapist gets involved in that situation to help teach speech sounds that should be being produced that aren't produced. We are also involved early, even before the surgeries occur, with our babies and their feeding. So we can provide guidance to the mother about special bottles and nipples, positioning techniques to make the baby more comfortable and feed more efficiently so they get proper nutrition.
So can you explain some other craniofacial conditions that can happen, since this is the awareness month that we're looking at today?
Sure, yeah. So a lot of the craniofacial conditions are often associated with genetic or chromosomal abnormalities that occur in utero. So those kinds of issues can be something like Pierre-Robin sequence, Treacher-Collins syndrome, Apert syndrome. So these can affect not just a cleft lip and palate, but also the cheeks, the jaw, the teeth, the ears. A baby can be born with atresia, which is a missing ear canal, anosia, which is a missing outer ear, or microtia, small outer ear, and that can affect their hearing and therefore their language development.
And you guys are here to help them along the way. Thank you so much,
We are
Courtney.
here to help.
Yes, thank you, Courtney. And if you need the clinic's contact information for referrals, we're going to have that all attached to our Wellness Wednesday story on CBS19.tv. Thank you again.